drain refers to the migration of highly skilled and educated professionals from one country to another, often resulting in a significant loss of expertise in key sectors such as the health sector. Africa has been particularly affected by brain drain in its health sector, with many trained medical professionals opting to work in developed countries due to factors like better pay, working conditions, and career opportunities. This exodus of skilled health workers has had detrimental effects on Africa's healthcare systems, leading to understaffed facilities, reduced access to quality healthcare services, and increased workload for the remaining workforce. In the light of this challenge, the African Health Observatory Platform, AHOP, convened its annual meeting in Abuja, Nigeria, focusing on health policy-driven outputs to enhance health service delivery across the continent.
One of the major areas to achieve universal health coverage is service delivery. So that if you don't have the health workers, if they are leaving, then obviously it means we cannot achieve universal health coverage, and the health of the citizens suffer. People cannot have access to the health services they need. So that's why it's important that this issue is addressed, is tackled, for us to be able to strengthen our health system. I mean, even if you look at it, if you look at previous indices, we're not even achieving the health worker patient ratios needed for many services. We've not achieved them, the global standards, and now people are leaving. So it means those ratios are even getting worse. So it's going to be very difficult if you don't address it. So that's why this gathering is quite important.
This dialogue is anchored by the World Health Organization (WHO) Africa Regional Office in Brazzaville, Congo.
One of the key indices in the region is that we have almost 30% of doctors and nurses that are trained in the region are unemployed for several reasons, or underemployed for several reasons. So at the end of the day, we need to find solution on these root causes. Also, one of the issues is a skill mix of training. So we are in a position where we need more nurses, we need more midwives. Some countries have done a lot of effort, like Nigeria. When you see the evolution from 2013 to 2022, the numbers of people trained has really hugely increased. We have more people that are trained, we have more people that have the skills. But now, the absorptions either by the private or by the public sector is still low, or maybe that's where we need to find policies to change the trends in terms of those people going out looking for green pasture.
With support from the Bill and Melinda Gates Foundation, the focal point countries are Nigeria, Senegal, Rwanda, Kenya, and Ethiopia.
Let us stay and do the best we can. Because if we all take off, don't want a country that will cave in. We want to keep a country that our children and our children's children's children, our posterity will be proud of. And we have very good, very qualitative, very hardworking, very patriotic health workers. So we are going to encourage them and boost that energy.
From this dialogue, actually, what we're actually trying to do is to find a way to mitigate this brain drain crisis that is currently happening in the country. And you can see that other countries are equally invited, so that we can learn one or two things, because it's not just only Nigeria, it's happening across Africa. If you look at the statistics from the WHO, you can see that Nigeria is among the 6 countries that are exporting healthcare workers outside Africa. Do you understand? And we're equally among the highest number, 6 countries producing healthcare workers. But the issue is that we're equally among the highest exporting.
How can we stem it? So for me, it's very, very important, because for us to deliver on healthcare as a country, as people, as legislature, who I am, there's need for dialogue, around this topic, because it's very, very critical. We can only achieve a universal health coverage if we have a quality and a quantity health, workforce.
By focusing on bilateral agreements, capacity building, incentive programs, and data collection, stakeholders are working together to develop sustainable solutions that will help retain skilled health workers and strengthen healthcare systems across the continent.